chime in on this one. And the reason why is because my first goal was to get home. Okay. So I was gone 2 months away from home. I was aching.
My brain wasn't right. I didn't know. So for me,
when I was talking about those kind of step-by-step plans, a lot of times that was my role, was trying to set up what that plan looked like while people
were beyond seeing anything beyond that really wasn't my focus. Mm-hmm. So now I get home.
Basically, like what you're basically saying is your plan that you have these step-by-step.
Whatever the therapist recommends. And so I think that is probably what we're both all bumping up against right now.
On this episode of Connecting the Dots, we will be talking about vocational therapy and also a patient's perspective on if they knew about this resource. We do want to get information out there for stroke survivors as well as brain injury survivors of the resources that are available to you. My name's Betty Howard. I am a hemorrhagic stroke survivor due to a cavernous malformation. And we also have Greg Graham on today, and I will have him introduce himself, and then also Shelby King. Go ahead, Greg.
Thank you, Betty. My name is Greg Graham. I'm a stroke survivor. I had what's called a hemorrhagic stroke as well, but my stroke was called a arteriovenous malformation, basically leaking in the brain. When you have your arteries and veins, they have capillaries that's supposed to connect, it's supposed to be a straight line. Mine was all knotted up, and then it ruptured when I was 41 years old. I live in Atlanta, Georgia. That was 3.5 years ago when it actually ruptured, and I'm happy to be here. Thank you.
Absolutely. And Shelby?
Hi, also happy to be here. I am a vocational therapist by training. Most of my work experience has been with a local nonprofit hospital here in Atlanta, where I worked for about the past 4 years. And prior to that, I worked as a vocational therapist for individuals with vision impairments. But really, brain injury has always been something that's interesting for me, and it's touched my own life as well. And so happy to be a part of anything that helps survivors.
Excellent. Thank you for being here today. And we'll start off with, what is vocational therapy?
So vocational therapy, a lot of it is focused on return to work. So for example, my credential, I have a master's degree in rehabilitation counseling, and the main focus of that is helping individuals with disabilities to be able to work. I chose from there to go on and get a certification in vision specialist so that I could work with individuals with vision impairments. But really, like I said earlier, brain injury has touched my own life personally. And so that was really my passion. And I wanted to work somewhere like the hospital that specialized in brain injury, where I've been working for a long time. And so vocational therapy, part of it is work. There's a large emphasis on that. However, it's really, what can you do to be productive and get back to what you would consider normal life? You know, there's some parts of it are going to be a new normal, but it's what can we do to kind of get you there? And for some individuals, that's not work right away, but it might be volunteering or getting involved in your community in other ways. And so I would help people identify things like that they can do after therapy to continue to get better.
Excellent. And Greg, did you know about vocational therapy when you were released home from the hospital or rehab?
This is the first time I'm hearing about it. This is pretty interesting. Like, I had no idea that this was actually available to me.
Okay. And Shelby, can you tell us who is able to receive vocational therapy?
So that's a really good question. It's a little more complicated than it might seem on the surface. Okay. So at the hospital where I worked, vocational therapy was an added service, meaning that was something that was available to all of our clients. But more broadly, not every hospital has vocational therapy. Sometimes that same aspect of what people are going to do when they return home would be handled by a case manager or a speech therapist in a hospital setting. So the main place that you see vocational therapy is in state agencies for vocational rehabilitation. And every state has one. And for most states, the only eligibility requirements are that you are an individual with a disability and that you want to work. And if you meet those two things, then you can qualify for services through those agencies.
Okay, I see. And Greg said he didn't know about this service. And I'll be honest, I'm a survivor as well. When I was released home and went through, I mean, I'm 2.5 years post-stroke. I did not know about this at all. So how can we help more people find out about vocational therapy?
So I think forums like this are really great for doing it. I always have had a big passion for telling people wherever I go, no matter where they're from. If they're in the US, your state has a vocational rehabilitation agency. So once people know that that's an option for them, it's really just a matter of signing up and then advocating for yourself for services through the state. A lot of times those caseloads are very large for the counselors who work for the state. And so it's just important to kind of take ownership and stay on top of your case. But yeah, I mean, I think a lot of the state agencies try to do outreach and let people know about it, but it is a shame that there's still so many people out there who don't realize that this type of help exists for them.
Absolutely. And this is really great with helping connect the dots between, professionals and caregivers, because sometimes as a stroke survivor, we're not able to really know what we're ready for at that moment. But this is definitely great. Greg, what would you say was the most challenging aspect of your recovery?
Basically that part right there, like understanding what was available to me. I didn't know what was available to me. My situation is slightly different than probably most people, or it could be similar to people. I don't know. No, I was married and I left my house and I lost my insurance. So I tried to get on state funding, such as Medicaid, and that was very difficult. I couldn't get it. And then when I would go down to the government offices or the state offices, I would ask them, is there anything available for me as a stroke survivor? And it was like, no. So there's a lot of hidden gems out there that is very hard for people like us to find, especially after our brain has been scrambled and we don't know what's up from down and we don't have a caregiver to look after us. So that was probably the hardest thing for me, just trying to cope with how to be a person again without having the blueprint to do that.
Absolutely. Shelby, do you have any thoughts on that?
Yeah, unfortunately, I think that's a very common experience. I think until someone finds that right professional who knows that right resource and they ask those right questions, sometimes there are a lot of things out there that people are not really sure what their options are and what things can help them. And so they don't always even know what are the right questions to ask or who do I ask those questions. And I think for a lot of people, a lot of those questions get run through their doctor, but doctors can't know absolutely everything about every resource that's out there either. And so I think the approach that our teams and our therapeutic process that we had was we were effectively communicating across disciplines. So I was in communication with speech therapists, occupational therapists, physical therapists, the doctors and nurses, the case managers. And I think that level of communication really leads to a better quality of care for a patient, because those dots get disconnected. We're here talking about connecting all the dots. And I think it's really hard for people to do that and to even know what the right questions are to ask. So I definitely think that, unfortunately, that is a very common experience that people have.
Got it. Greg, any additional thoughts on that?
Yeah, that's a very interesting thing, because like when I had my stroke, Betty, I was in the state of Kentucky and my insurance was based out of the state of Georgia. And their only concern, and it's no fault to them because that's what we was really requesting, is get me stable enough to get home. So they did my physical therapy, my speech therapy, my occupational therapy to get me well enough to be transported, because it's about 300 miles from where I was in Kentucky to where I lived in Atlanta. And that was the only concern. Fortunate enough that my wife at the time, she filed for disability for me. I didn't know anything about that. I thought by the time I got home, I'll go to work the next week. I didn't understand my condition. I didn't understand what I was. So Shelby brought up an interesting thing, asking the right question. I don't know what the right question is as a stroke survivor at that moment, because the only thing you're thinking about is, I'm getting back to normal. I'll be there. I don't need help. I just get me out of this place and I'll show you. And I think that's the thing that we have to figure out as we connecting these dots, how we can actually let the professionals understand where we are, and also how we can let the professional know where we are as well. So back and forth, so make it better understanding for each other.
Absolutely. And Shelby, can you chime in on that? For caregivers, what are those pertinent questions that they should be asking?
Yeah, that's such a good question, but also a really hard one. And the reason for that is because just like every person is different, every brain injury is also different, and how it affects that person is going to be different. And then even within the same person, like Greg alluded to, you have different goals at different times. So at that first point, his goal was just to get home. Once he got home, surely he had different goals because he was home. And so I think that's an important thing to remember, is that those questions are going to change at different phases of the process. For the caregivers, asking about resources, I think, is really important, but also just listening to that person that you're caring for, and listening to what their goals are. And even if you know they're not ready yet, letting your professionals know eventually this person would like to go back to work. Or, I've had people who have goals like, I'd like to be able to care for my children, or I'd like to go for a walk with my dog. It can be anything. But I think letting therapists know, or doctors or nurses know what those goals are and how it changes over time is really important, because there are so many differences between different types of brain injuries and just different people, that it can make it, we can't throw all of the information at a patient at once, or they'd be very overwhelmed. And so what we always try to do as therapists is answer the questions and get them the right resources when they need them, and not overwhelm the person with information. And so that dialogue is really important. And as those goals change, letting your therapy team know what the new goals are, I think, really helps.
That makes total sense. What would you say, from the years in your background and working directly with patients, what do you feel like the largest or biggest challenge is for your patients in their recovery process?
Exactly what I just said, I think is one of the hardest things to do. And so I don't say all of that to diminish how difficult it is. I know that you're dealing with so many different things. Who you feel like you are has changed, because your brain makes up so much of who you are. And so I know it's not easy, but trying to communicate, let people know what you want. That can also be really difficult, because for some people, their brain injuries affect their ability to communicate. So I think just being open about what your goals are, even if you're not ready for it yet, letting people know where you'd like to get in the future. And then coming up with a plan with your therapy team for little steps along the way is really important. So I think self-advocacy can be a really big challenge, but it's also really important to people's recovery.
Got it. Any additional thoughts, Greg?
Well, yeah, I'm going back and forth with a couple of things inside of my head, and I'm thinking like the self-advocacy and also, having a great plan. But the issue that I had, Shelby, was when I was about to go home, I knew my date when they was going to release me. I knew the date that my wife was going to come get me, and everything they was actually teaching me to say, okay, you could do this at home, keep in contact with us. That went one ear and out the other. I didn't care. I just wanted to get home. So I'm trying to figure out what kind of solution would you suggest? Like, would you try to put like a blueprint in front of us from day one? Or do you wait at the last minute? Because at the last minute, you don't have my attention anymore. I'm trying to get home.
Right.
home cooked meals and all things like that. So how do you actually break that down? One, and two, do you actually deal with the caregivers themselves, trying to get them to understand what their new life is and how to function in their life as well?
Yeah. So to your first question, I think when it comes to kind of breaking it down, my approach would be, because sometimes I would get clients referred to me and the therapy team would say, this person keeps talking about work. They really want to go back to work. We don't really think they're ready, but we think they should meet with you so that they can come up with a plan, or you can at least start having those conversations. Because sometimes it is complicated to get back into work and we need some time to plan to make it happen. And sometimes there are more options than we initially realize, depending on where you're working and how long you've been there and all of that kind of stuff. So my approach was always sit down with the person, understand what your ideal world, what are the things that you could be back to doing tomorrow? Just a miracle happens and you're magically able to do one thing. What would be that one thing? And so usually I would start with identifying what that thing was. If the person wasn't ready yet, and I'll give an example just to make it a little more concrete. Let's say someone's job involved giving lots of presentations. Maybe they were an executive or something, and maybe their stroke affected their speech. And so their team might have said to me something like, their speech is still impaired. We don't think they're really ready to go back to doing this, but we want them to have a conversation with you. So if I sat down with the person and they said, I really want to go back to work, I would say, okay, so that's the goal way up here. What's a goal we can work on while we're right here to get us there? That'll get us from here to here and get us one step closer. And so I think it's really helpful to have someone in your life. It doesn't have to be a therapist. It could be a family member who can help you think through, okay, what is my longer term goal? And then what are smaller steps I can take to get there? And then I think that also another thing that really helps with is motivation, because suddenly it's not this far off goal that feels like it's never going to happen. You're then suddenly able to see the small steps that you can take to get to that far off goal and that you're progressing. And I think that can really help people continue to get better and better. And then you had another question about after you got home and you were saying at the end of therapy, they didn't have your attention anymore. What was that question about, Greg?
They basically like what you're basically saying is your plan that you have these step by step, but like, and it might be for all different fields of therapy that I was getting. I didn't really care for the physical therapy, the speech therapy, and occupational therapy anymore. I just wanted to get home. I'm like, okay, I understand what you're telling me. Okay, these are exercises that you need to do when you get home. I'm like, okay, here's the paperwork. Thank you. Where's my car? How can you keep my focus? And the other question was really about the caregivers. Do you have something for them? That's really more of where I wanted to go, because you basically answered the question with the detailed planning of a project plan of how you actually get back. How do you deal with those caregivers? Because a lot of times I see them being neglected. They don't understand what's going on. They don't understand that their stroke survivor or their brain injury person is not the same person. They think like a broken leg, once it's healed and once the physical ailments is gone, they're healed, and that's incorrect. How do you actually deal with those people?
So yeah, I love that question because I think it's just so important. So I cannot tell you how many times I insisted that a family member or a caregiver attend my sessions with the patient. And depending on the person's situation, I might be really firm on that insistence, or I might say, they can come if you want them to come, but I would always try to include them, because I think when you're talking about getting out of the therapeutic setting and getting back into the real world, into your life, you're going to need some support. And it doesn't really matter who that support comes from. It could be a family member, it could be a friend or a coworker. I can't tell you how many people I have met that their former boss would come to therapy with them because they just had that family kind of relationship and closeness.
Right.
And so I would always try to loop one person from the person's real life that knew them beforehand, could speak to what the differences were, because we don't always know what the person was like before their injury, and that could kind of work with us to put into practice some of the things we were talking about. And I think that is one of the harder things to do. And I think it's something that, especially because if you just think about how your health insurance pays for your therapeutic process, all your therapy and seeing your doctors, all of that kind of stuff, you're their customer, you're the patient. So the health insurance is not always thinking, what about this person's family members? But we all recognize, as people who professionally work with this population, that caregiver or family support is really important. And so I would try to loop people in as much as possible. And from a patient's perspective, I would say that means maybe not all of your therapy sessions, but maybe your family member comes with you for a training day of therapy. Because if you let your therapist know, I'd like to bring in my wife, my husband, my mom, my dad, my son or daughter, whoever the person is, the therapist can then explain to them what you need to do, and they can kind of help you put some of those things into practice, even if your focus isn't all there in that session to know what you're supposed to do when you get home.
Yeah, but that throws me off even when you say that, because, you know, my brain wasn't right. I didn't know. So for me to say, I want my caregiver, I want my wife, I want my mother, I want this person to be there. I didn't know. I just thought it was automatic they would be there. Mm-hmm. So I don't know. I think that's one of the dots that, as a professional, you know, you guys are assuming that we understand that and we'll push that forward. And we're thinking it's already done for us. So we have to figure out a better, I guess, solution, a template for people with this type of injury to actually have from day one. Okay, once they get in, okay, now they in rehab situation. Let's get the caregivers in. Who's the caregiver? Let's make sure everybody's on the same page and things like that. Because if you're waiting on us to actually tell you, and am I wrong, Betty? You know, because I know for me, yeah. I was gone.
Well, I definitely want to chime in on this one. And the reason why is because my first goal was to get home. Okay. So I was gone 2 months away from home. I was aching to get home. So beyond seeing anything beyond that really wasn't my focus. Mm-hmm. So now I get home. Okay. And then I do my outpatient therapy. And I do that for about 3 months or so. And they're like, okay, you're checked off. You're good to go. You know, now I wasn't ready to go back to work at that point. But one thing, if there's professionals watching this that I think could be a good resource for us now that I'm 2 years and I can look back at the situation, is maybe putting something together almost like an org chart or like a step-by-step process to say, this paper is really important. I want you to hold on to this. Now, this is the beginning. You're going to start with just getting home. Okay. Once you get home and you go to outpatient therapy, and then you get through that point, and what's the next step? Are you ready to go back to work? And if it's, you know, check mark yes, then vocational therapy would be something. You're ready to volunteer. Vocational therapy is an option. If it's a no, then what's other options? Because I think what happens is when we get home, we plateau. Mm-hmm. And we don't know where to go from there. And or even, for example, in regards to physical therapy, okay, you're showing me to do these arm raises, right? Well, now I can lift my arm up. So what do I need to do next after that? So I think a step-by-step progression of a yes box, no box, and then almost, you know, giving us like a little roadmap would be so valuable for us.
I agree. And I think that was what I was talking about, those kind of step-by-step plans. A lot of times that was my role, was trying to set up what that plan looked like while people were with us. Because you're right, once you're discharged home and you're not coming in every day for therapy, or maybe you're still coming once a week, but most of your time is not in therapy, it's back in your real life. I think that does happen. And so I would oftentimes be the person that people would come back to and say, hey, I've been doing all of my home exercises. I know I met with you and wasn't ready for work yet, but I want to talk about it now. And so often I would schedule a session for someone to come back and talk with me. And then we would say, oh, you know what? You've really made a lot of progress. Let's maybe talk to an occupational therapist about driving while you're here, because that would help you be able to work. Or let's maybe talk to a speech therapist and see if you can make some more progress in speech therapy. So I think that part of the disconnect and what survivors don't always understand is, as therapists, we're expecting after a brain injury, you're probably going to have multiple rounds of therapy. It's not going to be you're in the hospital and you go home and that's it. For most people, their journey is going to be longer than that. And sometimes it's even several years of coming back for therapy once every 6 weeks or 8 weeks or whatever the therapist recommends. And so I think that is probably what we're both all bumping up against right now, is that's the misunderstanding, is that we see this process all the time for so many clients. And so in our minds, we think this is a journey, not a race. People are going to go through several phases of this. We need to find a concrete goal for this round of therapy. We're expecting you'll come back and we'll help you progress. When you start to plateau, you'll come back for therapy and we'll help you progress again. It doesn't always happen though. And I think it is because that's what the misunderstanding is why would you know that? If you're just a person who was living your life and you had a brain injury, why would you know that we're expecting you would have several rounds of therapy? And so I think that's maybe the important thing for people to understand early on, is it might be a long road ahead of you. It's when you get out of the hospital, things probably aren't going to go back to normal right away. It's going to be a longer journey, and letting people know there's going to be peaks and valleys in that, and that's okay too.
Very good. Now, shifting gears just a little bit, Greg, what would you say was the biggest factor that actually helped your recovery?
My recovery, my children. I had motivation. You know, my children used to tell me all the time, Daddy, you're great, you're strong, or Daddy, you're not the same person you used to be. Where's my dad? Okay, it's time for me to get up and work out. It's time for me to work on memory games. You know, it's time for me to do things to get my cognitive skills back together. So that by itself, just seeing those things and understanding those things, well, the ability to understand those things helped me out tremendously. Because if I didn't have my daughters, I'd probably be in a vegetable state right now, vegetation state. I'm telling you.
But you're doing amazing. And now you're the AVM superhero, getting information out there to the community. So we are definitely thankful for what you're doing. And Shelby, in regards to the professional aspect, what would you say is the thing that stands out when you're looking at your patients and you're like, you know what, this person's really progressing, and I believe it's because of what factor would you say?
I think a lot of it, so there's kind of two answers. There's the more medical answer is however healthy you were before your injury will impact how quickly you recover from your injury. So there is some element of, if you were a super healthy person before, you're probably going to recover a little more quickly, or more likely to recover a little more quickly. No guarantees. So that's one aspect, but I think what I've kind of learned is the more interesting thing behind that is that there's people often say correlation does not equal causation. And when they say that, they mean just because two things kind of go together, there might be another completely different factor that's causing both of those things. And I think this is a case for that, where if someone was very healthy before, they were investing in their health, they might have had a habit of going to the gym or doing a meditation or doing yoga, doing healthy things to take care of themselves. And I think that ability to motivate yourself for you is that Z factor that impacts people's recovery too. Because I've definitely seen people who plateau after their first hospital admission and don't get better for many, many, many years. But the people that I've seen continue to get better and better, sometimes even 5 years after their injury, they're still getting better. You know, never give up hope. If there's one thing that you start to think, maybe this is never going to improve, it can. And I know that because I've seen it. And so I think that motivation, being able to motivate yourself, finding the things in your life that motivate you to want to keep getting better, is really, really an important factor. And so Greg had that with his daughters. He saw them and that got him to get that motivation back on his hard days. And I think everybody has something in their life like that motivates them, and finding that thing. And even on days where you can't do it for yourself and you're not feeling good, do it for that other thing. I think that's a hugely important factor.
Excellent. And Greg, do you have any additional thoughts?
No, I completely agree with her. You know,
Yeah.
I really felt like my health before, because I used to play basketball, I used to run, I used to swim. You know, that helped me get back to where I was, and also the motivation factors. So I'm not really sure what exactly it was, but I think those are major contributors.
Excellent. And any resources, Greg, that have stood out to you since you've been home and you've been on this journey? Are there any resources that have popped up for you that you find valuable?
Yeah, there's a lot of resources out there, but it might be a little bit more conventional than you might think. Resources for me is I, I was on a journey, and what I saw was life, and I understood life a little bit better. You know, I wanted to walk again. I had the opportunity to be with my grandniece, and she was learning how to walk. So every time I saw her fall, she'll get right back up. So I'm like, okay, so why am I getting mad whenever I fall? I know that I'm just like her. And I also know a 100-year-old woman. She's about to die. And she's telling me things about life and what I'm supposed to be doing within my life. So I'm looking at her, I'm like, okay, why am I complaining? Why am I upset? I'm living. I need to get forward. So those practical things I had in my life, everybody could basically see. They just have to sit down and be patient and see that. Another thing was Instagram, social media, how I find people out there that was in the same predicament that I was, and it was thriving. And that motivated me to get out there and do the donations that I do with my care baskets, and also the interviews that I do.
Excellent. Well, I do want to say, you're honoring on AVM Superhero, you're honoring May, Stroke Awareness Month, and that you are going to have more of these episodes of Connecting the Dots. So please stay tuned for additional people who have had traumatic brain injury for different various reasons, and then also professionals that are going to be on to give us some really great information on how we can do better when we get home, and how we can connect those dots and let survivors know that there's hope for you. Yes, like Shelby said, this is a journey, but don't give up on the journey, because there's some really beautiful things that you can see on the other side of it.
Absolutely. Absolutely. Well said.
Well, thank you so much, Greg, AVM
Thank you.
Superhero, for having us today, and Shelby King, taking time out of your day. I know you have a busy schedule to get on here and speak with us.
My pleasure. Thank you for having me.
Thank you, Betty.
You're welcome. Take care.
Bye. Thank you for watching Connecting the Dots. I really appreciate the people that I had on my show today for helping us bring more light to this troubling thing of brain injuries and stroke surviving, and understanding what type of help or technologies is out there for us after we leave the hospital. I'd like to thank my host, Betty Howard, for coming on and giving her perspective, and also allowing us to talk and flow very nicely. And also, I'd like to thank Shelby King for her expertise in vocational therapy. And so Shelby would like to give you guys some more tips or resources that you guys can go to if you want to know more about vocational therapy in your actual state. Here's a list of different organizations that you should check out. Just Google them online, and hopefully you guys will come back for our other episodes that we have. We should have about 8 altogether. Stay tuned to our Instagram page at AVM_superhero, and we will give you updates on next time we'll have another show. Thank you guys so much. Appreciate you guys. AVM Superhero out.